My name is Stephanie.
Stephanie?
Yeah.
I'm James.
Hi.
Here, come have a seat on this ball for right now
I didn't.
for a moment.
Oh man, this is gonna end.
Have you ever
poorly.
sat on a ball before?
I sit on my desk at work,
Perfect. So
but I've never been to the gym.
Never been. It's okay. I'm not gonna ask
Ever.
you anything on the ball, right?
Like, not joking.
You've never been to the gym ever. So
Ever.
those are actually some of my first questions for you. So,
Okay.
well, what exercise do you do, or do you do any exercise?
I don't.
Nothing
ever.
during pregnancy. Nothing before pregnancy. Okay. And so no history. How about aches, pains? Have you had any?
No. Nothing.
No aches, pains. No.
Nope.
No, like even before pregnancy. No, like oh, my knee hurts when I walk for this
No.
long or stand up.
No.
And you use a ball at the desk.
Yeah.
So that's interesting.
My
So-
midwife recommended to not sit in that chair that I had.
So is that recent then?
Yeah, it's
So-
just been the past like 5 months.
Okay, cool. So her midwife recommended
Dana?
recommended
Yeah.
sitting on a ball instead of. Now, why did she recommend that for you?
Just to kind of be in this position all the time and kind of, stay moving.
Yeah, and
Because I'm at my desk like 10
it-
hours a day.
It keeps, sitting in a chair in a fixed position literally fixes the muscles in that position and the joints. So yeah, really wise, very good. Good when you're not pregnant too. So keep it
I'll
up.
probably keep it.
You probably keep it. Yeah, it's great. I once had a client who had internal rotation, massive. I mean, I don't know if you lay someone on their back and you go internally rotated, like almost everyone locks at about 0, and it should be 45. And he went from 0 to like 30 in a couple weeks just by sitting on a ball at his desk. So yeah, very, very cool stuff. I don't know if you know what you got yourself into. But
I don't.
You don't?
I thought it was just going to be you and Dana. To be honest, not a camera and a bunch
tricked
of
you.
people. Totally.
tricked you.
Yeah.
Okay, well, the idea here is
I would have
that-
dressed better. Yeah.
I'd have dressed
I'm like, been in this all day.
Well, the idea is that we're going to perform an assessment on you.
Great.
Like, so we'll have you
Fantastic.
we'll have you do like a few different movements, like a squat and stuff like that, and we're just going to ask you like, hey, where do you feel it?
Okay.
And then at the end, we'll naturally be looking at where your muscle imbalances and things are, and then
Or aren't.
That's
Okay.
right. We'll give you good feedback on that, and then at the end of the day, we'll send you out of here with.
And I can't even go have a drink afterwards.
So,
This is dreadful.
no. Well, yeah,
All right. It's cool.
you're going to be okay though.
Yeah.
And yeah, so I think that's it. So let's get started. So I'm going to come around the room again now.
Wait, how far along are you?
I think
Good question.
I think
far
I'm
along?
about 35 weeks.
35.
Yeah, I'm not tracking this one as carefully as the other two.
Yeah.
This one I'm just like whatever. When it comes, it comes.
Okay. Oh, so
This is my third, but they're spaced out. One's 18 and the other one's gonna be 6.
Wow.
Yeah.
Cool.
Are you having a girl?
I don't know what I'm having. I didn't find out.
Have you had midwives with your
Sorry?
Have you had a midwife with your other pregnancy?
No, I haven't. This is the first home birth.
How were your other births then?
Great, normal.
Did you have them out in the hospital or outside? the
No,
hospital?
in the hospital. The second one was completely drug-free. Like I barely made it to the hospital.
Oh.
And then the first one was, I was pretty young, so it was like the epidural and like everything that they
But you
tend
did
to do.
deliver vaginally
Yeah,
first?
both of them.
But epidural, Pitocin or no?
Pitocin, they induced
Epidural and
me,
Pitocin.
had the epidural.
So,
all that.
so they induced you first, and then
Then they gave me the epidural.
Okay.
Yeah.
And now you've come along in your idea of wanting to birth
Yeah.
naturally, and you're
Yeah,
comfortable.
I'm 40 now.
40.
Yeah, so.
Why did you decide to do it differently?
Because I've been to a lot of births in the hospital.
What's your profession?
I'm a food and beverage controller.
Oh, okay. So you've
But
just
I have not, that has nothing to do with
okay.
birth.
You've been to births for other reasons.
Yeah, just I always end up at births for some reason.
Okay.
And I know how it is. You go in and they want to give you things and you don't really have a voice, and it's, I've done it before. I know what I'm getting myself into, and I'm just more comfortable
Yeah.
being at home this time. And I love Dana. She was fantastic.
Yeah.
So,
That's great.
yeah.
All right, cool. So let's get this underway. Stay. You are a student. Let's go. You're gonna be just fine.
You're going to be better off than me no matter what. So just.
Actually, I'll let Stay direct. You're doing breathing. That's what you're doing. Okay, I'll help. So it's what's the cue for asking someone to breathe in the breathing assessment? Would you mind to turn this way, actually, toward me? Take a deep breath. Standing or seated. We can do both. Let's see what happens. And then I'll follow it by saying, take a bunch of deep breaths, just back to back, and relax. Don't hyperventilate or anything, but just keep breathing deep. And then tell us, what are we looking for in this one? Yeah, and in this one, it's not so much where she feels it as much as what area of your body's moving, right? So you feel your diaphragm, and then what do you guys see while she's indicating diaphragm? You see what?
Her belly's moving as well.
There is some belly movement up here, but the dominance is in her chest. Now, it's not uncommon for people to, especially people who know the word diaphragm, to say diaphragm, but while it's the chest, right? So then on a scale of 0 to 10, you want to do it? Yeah. The question is 0 is very, very easy to breathe. Like heavenly angels are breathing for you. And 10 is very, very difficult. You can't breathe.
I'd say about 5.
5.
I mean, just at this point in my pregnancy, it's more difficult,
Okay.
and I just ate. So.
And you just ate? Okay, fine.
But it's not terribly difficult.
Okay, so she said a 5. So will you stand up and take a few more deep breaths and just tell us if there's anything different and give us a chance to see if there's anything different?
It's easier to breathe.
So she feels it's easier to breathe.
Like it's more open.
What area of your body is moving? What area of your body do you feel moving?
My same area.
Same area? Okay. So and you're conscious that you're moving, you sort of indicated down here and now you're sort of saying up there.
Fuller the breath I feel.
Okay. Sometimes people are uncomfortable on their backs during pregnancy.
Okay.
I'd love you to lay on your back if
Okay.
you feel comfortable.
Yeah, that's
if
fine.
not, you can
No,
lay
I'm on my
yourself,
fine.
okay? Stay. I'll leave you off the hook. Ashley, come on. Oh, other side.
So I'm not coaching her, I'm just asking.
Yeah, you're not coaching, you're asking her.
Hi.
Hi, how are you?
You look really familiar.
I work at the Standard, maybe from there.
Oh, there we go. Okay. Yes.
Now, almost immediately, I want to get the RPE because she's just reported 5 and I want to see immediately what the deal is. So how difficult or easy is it?
Just take a couple breaths, just relax, same thing. Is it harder for you laying
definitely
down?
harder
It
laying
is
down.
because of the weight.
And I just a less comfortable position for
Do you
me.
want to lay on your side?
It doesn't make a difference, whatever you guys
So-
need.
Where's the block?
If you're comfortable there, I'm going to leave you right there.
Okay, I'm fine.
All right.
So-
just take some normal breaths.
She said that it's definitely more difficult. Again, she's pregnant in her 3rd trimester. Now ask her the next question though, Ashley.
Where do you feel that you're breathing now?
From here.
More.
Okay, so she's now in touch, and did you all see that her stomach was definitely moving more? So regardless of the report of it being more difficult, this is now diaphragmatic breathing. Okay, good.
Hi.
I'm gonna help you get up.
Oh, thanks. Awesome. Wait, all the way up?
All the way up.
Okay.
So I'm gonna have you face the same way you're facing right now.
Okay.
And you're just gonna bring your hips all the way in, like
Okay.
it, and then back out. There you go. Just keep doing that.
And then we want to pull from the client which area is more dominant or not for her.
What area do you feel is more natural?
Back, like this. Yeah.
You guys can all see that it was pretty easy, right? So it's easier for her to quote unquote pour the water out the front of her bowl than it is for her to pour the water out the back of her bowl. Good, done. Again, this can keep going faster and faster now. Val?
Just do a squat for me.
Oh God. Just like down. Okay, that's tough.
Just go as far as feels comfortable.
Yeah, I like maybe there.
Yeah, that's fine. Yeah, just keep coming up and sitting back down as many times.
Oh,
as
more
feels
squats?
comfortable.
Oh shit.
I would also say, don't go as low. Like get it something where you can kind of do a bunch of them. Again, one of the key components here is we need to see her natural. This is not natural right now. To some extent it is if she goes that low, but I just keep going at a pace where if I said I need you to do this for an hour, and I just need you to keep going. And then she'll figure out her own rhythm, and we can just figure. And that's honestly closer to what her reality is.
Where are you feeling this?
Right here.
And quads. And we're done. Oh, yeah, one more. Good call. Might as well direct her. The full squat.
Oh, yeah, okay. So can you get into this position comfortably?
More, are you comfortable getting into
I
that
can try.
position?
I mean,
Okay.
I'm sure I.
Because again, we don't want any client with us popping something or
Like this?
falling over backwards or
Okay.
whatever. We don't want to pressure her. Are you comfortable there?
I mean, I won't stay like this all day, but
Yeah. Okay, great. Okay. Now, did you guys notice what happened here? So what muscle is trying to stabilize? That's an overactive trap for an underactive what? Core, an underactive core, and also potentially an underactive glute. Cool. Becca? Actually, will you turn the other way? We're going to switch the, yeah.
Do you want me to use the...
Sure, if you'd like.
Bar?
By all
Okay.
means.
I'm Rebecca, by the
Hi,
way. Hi.
Rebecca.
So all I'm going to have you do is we're going to place the bar right on your shoulders, and you're going to...
Don't swing it. Don't
No,
hit
no,
it.
no, no. Yeah, no. Your space. And then all I want you to do is just twist, rotate naturally, and then
Okay.
look behind you. And pause when you're in the...
okay.
And then to the other side. And
All right.
pause. Okay?
Now, I would even cut off some of the wording and just say, look behind you, because I want to see what she does to look behind her. When you tell her to twist, you're already, it's very slight, not a big deal, but it's already starting to mold or shape it, No, absolutely not. That's coaching, not assessing. Now, by the way, the reason why we're going to do this, what command did you give her? You said, turn, look behind you, and then
Just ask me the other way.
Oh, great, yes. And then you're going to tell her to keep going indefinitely now. So yeah, keep going. $1 million we're going to give you in an hour. Keep going. The reason why this nature of this assessment and this purpose, by the way, we're doing it of asking her the questions is because, yes, it's important for you to have the information, but arguably, and we'll talk about this more tomorrow, it's important for her to understand the information. She needs to be saying it herself so that she's sold on your training. If she doesn't recognize what's going on, if you do not bring her to the awareness that it's actually in her quads, then it's not as meaningful to her later when you tell her she should be doing something else. We'll talk about that later. And the magic question
Where are you
is?
feeling this?
Here and down here.
So
So,
in your
yeah.
back, sort of in your
Yeah.
mid to lower back?
Yeah, I definitely feel it back here and down
So
here.
traps to
So-
your upper back
Yeah.
to mid.
So this is going to be the scapular area. You said also in here or no? Which is the middle back, where we're going to call that the erectors, middle erectors. And then she also indicated here, what are we going to call that?
Love handles.
Probably because it's this far behind her, it's QL. It is not the internal oblique. It is the QL now. So, and she's even like rubbing it out. These little subtle signs that this is an over or underactive muscle. Overactive. Now, the reason why she communicated this is because this was in her hand probably. Put your hands down, and then
And will you do the same exercise, the same
Oh,
motion?
this way?
Hands relax.
Yeah, it's definitely right here.
so now it leaves, I'm presuming it leaves your middle back, and now it goes more to, look behind you as you do it. Make sure you look at that wall. Boom. And then turn, look at the wall the other way. Boom. And where is it?
Yeah, it's all lower.
It's all in my lower
Lower
back. Okay, great. Thank you. Lisa?
Next one we're going to do is just touching your toes.
Not
No,
even
by the
pregnant.
way, anything we ask you to do that seems like weird, don't do it. Or maybe you do it just part of the way. In
Yeah,
other words,
that's
like,
definitely going to
yeah.
be a very part of the way. Like, that's as far as it's going.
And then just stand back up and just do a few ranges there. however you feel.
Like, this is even when I'm not pregnant.
Okay, so even when she's not pregnant indicates that she's likely tight in a variety of things. Where would they be? Could be hamstrings. Could be lower back, yeah. Could be calves. All the erectors right up over. Ankles, would it be more like the calves?
It's
and
just
the
I'm
muscles?
not flexible. And the belly's like,
And the belly's in the way. Now, mind you, she told us that she was like this before pregnancy, but the belly is still in the way. So let's, she's pregnant in her 3rd trimester. Question? The magic question?
Do you feel it?
Where do you feel it? If we made you do it,
I think like back here. Yeah, back
so
of my
she's
legs.
indicating hamstrings. Okay, done. You think I'm going to give it all away before you get up here, pregnant lady? I'll explain more later after your assessment. Which one are we on now? Lunge? Yeah, so again, she doesn't have a history of exercise, so I'm not going to have her do a plyometric move like that. I'm going to have her get into this position and then just kind of, you can face her.
Step forward,
Yeah, step forward and then just go as low as you can without any,
like with the knee forward,
just try to bend down and up without any
like this.
Yep, as long as you
As long as you feel comfortable.
Right there, uncomfortable.
And tell us where you feel it immediately. We need to get
I
her
feel
out of
it
this
right
position.
here.
In your knee, quads.
Like right here.
Great.
Okay.
Take 4 on the other side to
Yeah,
balance
straight
it. Great.
legs. Where are you feeling it?
Same.
Same areas?
Okay. I mean, that's it, especially on, you've seen now 2 in a row where the quads, or I'm sorry, where the lunge is a little precarious. By the way, we'll talk more about this, the PGP and the SPD and all that stuff. As soon as she's here and she goes down, where do you feel it? If she tells you on the first one, switch her. If it's like that. Like some people will have been doing lunges their whole pregnancy and it's no big deal. You just want to be careful with someone who hasn't done a lot of exercise, right? Yeah. Don't put her into new things. That's why that rule exists. So get her in and out fast. Thank you. What's the next one on the list? Bent row.
How's your body feeling today?
Great.
Okay, so we're gonna just be bending and we're gonna do this motion here. And if that feels okay, I'm gonna also add in
Okay.
these weights.
Okay, so what am I doing? I'm bending?
Bending, and then you're just gonna do.
Now,
Like
I'm going to
knees
say
bent?
time out on this one because in the fitness realm, when gravity is going this way, I want to see something like, as opposed to this, which actually may tell her to put it out here. So I want to tell her that this is we're picking something up from down here. And sometimes preferencing it like that makes sense. So baby's changing table, you're going to be in this position on some level. A coffee table that's low and you have a television there, but for our purposes, I'd like to see you lift the television over and over again. Make sense? Okay.
So I'm going to bend over and just pick them up.
I would hand them to her.
I'm sorry, this is why I'm here.
That's why you're here.
Okay.
Well said.
So what am I doing with them?
You're going to pretend like you're picking something up.
And I stay in this position?
Yes.
Okay.
Quickly ask her.
And then where are you feeling this?
I feel it in my knees and back here.
Knees and the calves. And where in your upper body are you feeling it? Let's have her do like 3 more to feel it.
Maybe like back here.
Triceps. And it just all falls into place. Thank you. By the way, I mean, props to a Pilates instructor who doesn't teach fitness for coming in and doing a fitness movement. You don't do this movement with your clients, so thank you. And now we have yoga coming up.
Yes.
Hi.
Yoga. Are you comfortable getting onto your hands and knees?
Yeah.
Actually, why don't you get on the mat onto your
Okay.
knees? So from your hands and knees,
Okay.
we're going to do just a couple push-ups. Bring your hands outside the mat,
Okay.
and you're just going to go up and down. A couple times. Don't go too low. As soon as comfortable. Good. Just keep doing a few of those. Where are you feeling it?
In my, like here and
Chest?
here. Yeah.
In your biceps?
Yeah.
Okay.
Chest and biceps. It's also important she said it in that order.
Yeah.
So, can pregnant women get into a push-up position? Of course. It's definitely a misnomer otherwise. That was very smooth. And we're done with the assessment, right? Okay, so what were the things that stood out? What's the number one thing you'd want to work on with this client potentially? You like scapula, what's that? Hip hinge. Yes, and if you're in this class, it's core breathing is almost always going to be the first and foremost. So what's going to give her the biggest bang for the buck walking out of here in the next 5 minutes? Core breathing on every level, both internally and musculoskeletal. But what are we going to work on? If we get her core breathing working, which assessment here would make sense to repeat? You can lay on your back for a moment, please. Let's try the squat or let's try the lunge. The lunge with less stability might give us a better sense, so I like that one. Let's see if core breathing, okay, so here's what we've said. You have a bit of an underactive core, which means that, let's say 2 things. One is your diaphragm doesn't go into the midsection as much as we'd like to see, according to our biomechanics scientists, right? So you already kind of know what to do. Let's say put your hands right here, and inhale and fill your belly. And put the out, well, you do whatever's comfortable for you. And then inhale, fill, and then exhale, let the belly go small again. You can do most of it through your nose if you're comfortable doing that. And you want to try to bypass your chest and not breathe into your chest. And then just close your eyes and kind of relax and don't worry too much. Like, I know there's a bunch of people watching, but you know, my job is to make it like you're going to be here for a few minutes. Take your time, just get a little better at doing this. And if you start to feel a little, you know, lightheaded, dizzy, or anything like that, we turn you to your side. No big deal, okay? Good. Is she getting better now? Okay, so we're starting to see it. So I said that diaphragmatic breathing is the important first part. You keep going. The second part is that what that's going to do is turn on your core muscles. You've heard of core, right? So core is important in fitness, right? Core is important even if you're not in fitness, though, because it affects how well you bend and squat and push and do these movements of daily life, right? So we'd like to see, if we were going to coach you, we would coach you on getting your core to work more, activate it more. And so how we're going to get it to work is we're going to inhale, fill, and then exhale and let the belly come a little smaller. Do you kind of see how you're sort of connecting to your core now? Good, so close your eyes again. And we want to kind of charge the core sometimes. We want to like, you know, you want a good degree of activity in it. So big inhales and big exhales. Does that make sense? And big inhales that come into the belly and massage your baby. And big exhales that give your baby stimulus that, you know what we learned in this class in part? Is that you can, by moving your belly like this, among other things, you can actually increase the intelligence of your child. Isn't that funny? I know, it sounds crazy, right? And the fitness, because your child is learning neurologically. So by giving your child, you know, you breathe 20,000 times a day. That's a lot, and the breath is supposed to be more in here. So we want to, not only, it's not just about oxygen and stuff like that, it's really about give your baby the stimulus of movement, right? So that the baby's nerves can branch, and it's essentially a learning protocol. Make sense? And then bend your knees when you're ready. Take a few more breaths. So what I'm going to ask you to do now, we're going to start to sequentially make it more complex. So on one of your next breaths when you're ready, I'd like you to just barely lift a leg off the floor, just enough for a piece of paper to go underneath. And then with the breath, put it down. And that's what I'd like you to get right now. And then you'll pick up the other one with the breath. Good. Now it's actually working better now that she's moving. So this sometimes happens with, believe it or not, athletes who are sort of like off with their posture and stuff, and then you get them going and their system sort of coalesces. I don't know what it is in your case, but this is a good sign that as she gets going. Mind you, she also reported not really having aches and pains, which for most people I don't believe. The moment that you start asking a little bit more questions, you'll start to get the reality. But I actually have an interesting belief in her right now. And so I'm not surprised if she snaps into some things faster than maybe some other people. So we're doing this lower abdominal alternate. As you can see, she's chosen which breath, the inhale or the exhale to lift. So she's chosen the eccentric TVA. Some weeks from now, we would then, once she's gotten this down, we would, in her program, we would change her to exhaling on the lift just to round out her mastery. What I'd like you to try at some point when you're ready, doing great, keep it up. We need to write this program, make it ingrained so that it can apply to your lunge later. So you see, I'm also educating her on what to expect, because that increases the likelihood that she's now starting to visualize or understand where to go. It's an eccentric contraction of the TVA. It's concentric for the diaphragm. What I'd like you to do when you're ready is lift both legs at the same time, just barely. Now what you have here is good to see. Take it a few more times. This is too much for the TVA to handle, and this is where you would maybe, somewhere down the road, if we really taxed her, start to see diastasis, because now it's pulling beyond her outer reach. Take it a couple more times. You can almost see a coning beginning here, where there's a separation that wants to push through. Naturally, it's stretched to begin with, but nothing to worry about. I just want to kind of see it. Go back to the alternating for a moment. You're doing a great job of slowly doing this. What I'd like you to do now is we're going to go to hands and knees, and I'd like you to remember that to get into that position is an exercise. So use your breathing, because that's ultimately what we're teaching you. Use your core breathing to move. So let's use your breathing to get into this position. Okay. Ashley, you had a question? Okay. I like to see what she chooses to do too, right? Does she go forward? Does she go sideways? You know, what is her natural comfort zone? Did you feel you had some access to breathing in that? Like you at least
I feel a little lightheaded.
And you feel lightheaded right now?
Yeah,
Okay. Are you good right now? It's sort of going away? Okay, so go hands and knees again. Just comfortable. Before you get too tired in the arms, let me know if you do. I'd like you to just breathe in and out of here. So again, hi baby. Inhale big, and then exhale, draw in. And you're seeing if you can inhale deep into your belly, and then exhale and draw in. I think you're doing pretty well with the inhale, filling in here. And I'd like you to get a little more exhale. There you go. You see that? How the exhale sort of drew in your tummy a little bit? Those are activating your core muscles. This again is really a positive for your baby. You know, your baby's surrounded by your uterus, a very strong muscle. So you know you're not going to hurt your baby? Is that a worry of yours?
No.
No, just making sure. Sometimes that is a concern. And the reason I asked her is because she wasn't drawing in. So I wanted to know that psychologically if that was a block for her. So what do you guys see overall at this point? Take a few more. So she's better at the inhale. The exhale here is a little tougher for her. That's fine. It is what it is. Will it relate? Will she be able to do it in the squat or the lunge? We'll see. Why don't you use your core breathing to sit back into this position? You can keep your hands kind of down here. Take a few breaths. There's a common set of exercises I might use, but there's absolutely no right or wrong. You just do whatever. Inhale. This is a cool proprioception because with her belly so close to her thighs, she has a direct feedback and pressure. Not unlike sometimes you do core tests with people are prone now, because that pressure of the stomach against the floor gives some good feedback. So again, what I'm looking for is inhale, filling the belly as big as can be, which I know you're doing, and then exhale, making the belly small, almost as small as can be now. Good. In my experience, you're doing good. This is great. Let me see. Let me see there. Good. She's getting it more now. Good. So you see that I'm using breathing to turn on your core. You don't need to breathe to do this, by the way. You get this? Like, I can, move, and you can move just like that too. So I don't need you to be lightheaded if that's what's happening, right? Last one here. One more nice. So this was better here, right? So in my program in the next week, I might be more likely to use this exercise than the hands and knees because she's doing this one better. You want to use the ones that are working. I would also use the supine one because that one's working as well. Now sit up right here, put your hands on your belly. See how this works for you? If it doesn't work here. Does that help to show the belly more? Does that matter? Sure, yeah, I love it. If you don't mind, do it. Inhale, fill.
Oh, it's moving.
Did you guys
so
see
creepy.
baby move in there? Pull that right off my hand. Good. Babies start moving a lot when you do this too. It's like communication, interaction. It's great. Pull it in, pull it in. Do you see how you're stronger in the breath from the face than you are with breath from the core? Does that kind of make sense? Make it breath from the core. Pull that core in that forces the air out. You kind of get that? The core pulls air in, that's it. And then the core pushes air out. That's a great cue. It just worked for her, and it'll work for your clients too. Push that air out. Whew, that's it. The core squeezes the air out. Inhale pulls the air in, and the core squeezes the air out. Close your eyes, take just a couple more, and imagine that you're doing a lunge. So you're going to repeat that lunge, and you're going to just slowly move with your core. You're going to use your core for this lunge. That means you got to move your belly. It's not just about breathing, it's about moving the belly. And then when you're ready, you can stand up. I am here to help if you want. Go ahead and show us. You're going to put 1 foot forward and 1 foot back, and you're just going to kind of repeat what you did before. But remember, don't begin until you've begun this. This is your starting ground. You can take about the same 4 or 5.
Do I come up on the exhale?
I only
or
want
no?
you to breathe. I don't care when
Oh,
you do
okay,
it.
it doesn't matter?
Okay, I want you to breathe and the belly gets big, and breathe and the belly gets small.
Okay.
And use that to go down, and use that to come up.
Okay.
And don't think anything more than that. Okay. So here we're going to do a breath to go down, and then we're going to do a breath to come up. In this case, it's an inhale down and an exhale up. And that's fine. Inhale down, and then I want a small tummy as you come up. And take a couple more and tell us where you feel it.
I feel it on my here.
Okay, so quads, which is the same thing she said before, right? One more. What do you guys see about her lunge right now?
My butt. I feel it in my butt cheek.
She just said she feels it in her butt. That's 5 repetitions and 10 minutes of core breathing. She feels it in her butt. Go ahead and switch to the other side. Mind you, did we even mention this to her at all? Does she know, even psychologically, where this should be? No.
I really don't know anything. I'm like the...
So she had no inclination of where it's supposed to go, and she said it. Now, I know there were some other questions, and we'll address them, but you have 5 repetitions just to kind of balance it out. Only go down as far as you feel. I think you don't need to go that far, okay? Just kind of be casual with yourself. Not a big deal. You're already going to be sore tomorrow probably, you know? Use your core breathing. This is your real practice. This is the last thing you got to do here with us. Big breathing. You want to learn to move with your breathing. You want to pick up your 6-year-old if you're still picking him up. You want to pick him up with some core activation. You know, you want to pick up the toys around the house with core activation. Core breathing. Okay. Okay, I'm seeing her point at some lower back QL, and I guess you said some glute also, and then the quad is still there. I asked a question of, thank you very much, of what do you guys see, and what I'm asking is, was the overall look of the lunge better, worse, or the same? Much better. And then she even reported that the appropriate muscle was starting to turn on. That's pretty incredible. I did not coach her on the anterior tilt or anything like that. All we did was start core breathing, good solid diaphragm into the chamber, good solid TVA. She was barely getting the TVA for most of it, and she's still able to produce some pretty incredible results. So what are we saying here is, as you go, our suggestion is that you connect a little more in here as you do movements. Is that pretty clear to you? Great. And then I'll come and see you, should you desire, on a separate occasion. You've left your information? Yeah. Okay, so we'll be in contact. So Stephanie, thank you. Oh. You're amazing.
Oh,
thank you so much. I know you got yourself into something you didn't know.
I totally didn't.
Yeah.
It was fine. Thank
Great.
you so much.
Thank you.